All right. Good afternoon, everyone. Excited again to share space and time and knowledge with everyone. I will say I'm happy to see that most people are feeling pretty good about the level of information that they're receiving. For those of you that were feeling like you're drinking from a fire hose, I'll be able to say today we're not going to deep dive into COVID. So this will be a break. We can all kind of take a breath and think about some strategies and approaches for engaging with our community from a strength-based or asset-based approach. I'm excited to share some of the tools that I have been working with these past 10 to 15 years working with community health workers around the world. And I'm happy to actually learn from everyone else here in this room. I know there is a ton of experience with asset-based community development and community-based participatory methodology. So I'm hoping that this will just, my presentation today will just be a stimulus to a wider conversation about how can we best meet people where they are, leverage existing assets and strengths, and then move forward with confidence and strength together to address common issues in our community. So the learning objectives for today's session are to generally start with what is asset-based community development and community-based participatory research. I've combined the two of these because CBPR is a set of tools that we can use to implement asset-based community development projects. And I wanted to just share the two frameworks to bring them together in our minds. And then I want to talk about what is the value of the strength-based approach. I want to share only two participatory methodologies that we can use to identify community assets and strengths. And then ideally, we'll wrap up with a conversation about how can these approaches facilitate pandemic response and recovery activities. And so I'm going to share a couple of ideas and approaches that our team has been using. But again, I really want to hear from folks here in this room about what has worked for you and how do we best engage with community. So let's just start with a definition of what asset-based community development is. And it's really a strategy for sustainable community-driven approach development. And it really focuses on identifying and using local assets to address those larger structural or social issues. And ultimately, to do asset-based community development, you have to have a belief in people and that everybody knows something and has strengths, because we have to build from there with the idea of matching strengths to community identified needs. And so it's a relationship building approach. It's a community organizing approach to engage in collective action to address the common good. And really, it's about discovering those assets, as I said, and then it's a set of practices and principles to mobilize people towards action to address commonly identified issues. And so there's a number of guiding principles behind asset-based community development, which are listed here on this slide, starting with everyone has gifts. We all know how to do something. We all are passionate about things. And part of our responsibility in community health promotion and engagement is to unlock those gifts and help people use those gifts to address things that are either barriers or enablers to help, to health, sorry. The idea behind it is that relationships are central to building community, and building community is central to addressing public health issues. With that said, people are then at the center. We need broad community involvement. It's not about identifying specific leaders or individuals to take the charge, but empowering all of our community members to be part of that process, and helping people identify those things that they care about so that they ideally are then motivated to act upon those issues. It requires two of our core health communication skills that we've been talking about throughout our ECHO series, active listening and acknowledging perspectives. And these are skills that I know our community health workforce already has in spades. And I just want to reinforce how we link back to health literacy principles and how asset-based community development can help us advance health literacy in our communities. And then the final principle is essential, which is that our institutions around our community need to be viewed as and serve as servants, right? We are here to help communities achieve their idealized state of health and well-being. And so how can we best leverage their resources and programs to serve the communities that we are working with? So when we think about assets, you can think about 6 core assets within our community. The first is people, which is the center of any asset-based community development, right? Everyone has gifts and skills and strengths, and we need to be able to unlock those and identify them. And because we can't move forward successfully without first unlocking that and helping people, have that aha moment of, yeah, I can do things. I do have a locus of control, and I've got resources and connections that can actually help us address the issues that we've identified. The second asset is this network of associations. So these can be informal groups like clubs or neighborhood associations that ideally have a common interest, right? And these are critical to helping create community mobilization. Think about our faith institution, our faith-based groups, some of our schools, PTOs. These are associations that can help us drive asset-based community development. And they have a common mission and vision. That's the important piece of it. It's not just a random meeting today, but we've come together for a purpose. The third group is our institutions. Oops, did I just advance my slides by accident? Sorry about that. Hit the wheel on accident. So institutions, these are our paid groups of people who are professionals and organized into institutions. These can be governmental agencies, they can be universities like UT Health, schools, etc. They are valuable resources, and they are assets that our communities can take advantage of and leverage to address the issues within their community. Then we can think about physical assets, land, buildings, space, funds. These are resources that our communities have that we have to help people realize what it is, right? If it's a meeting space, if it is a community garden, whatever those physical things are that we can bring together to, again, help us address commonly identified issues. An important piece of this is connections. And by that, these are the social relationships that people have. So it's not just about what we have and what we know, but it's who we know is really important. And for those of you that are familiar with this concept of social capital, that's what this is about. So it's not just important for us to build our relationships within our neighborhood, but we also have to have relationships to people outside of our inside group, right? People that have knowledge or resources that we may not have access to. And so how do we build and rebuild those connections and strengthen them so that we ideally have a broader base on which we can rely upon? And then finally, and really, most importantly, is our culture and history, reminding people of what we have done and achieved in the past, who we are as a culture and as a community. And a storytelling is a key part of this essential asset. And it oftentimes gets brushed aside because it's not something physical that we can hold on to and grab, but it is central to what generates identity within our community and often gives us a foundation on which to move forward with. So that's 2 slides on asset-based community development. And honestly, this is like a whole week-long training that I know many people have gone through, but this is meant to just be introductory. And now what I'd like to do is quickly shift into community-based participatory research, because this is a set of tools and orientation that can help us in community collect information that is community-driven and use that information to make decisions, affect policy, and engage in advocacy. And so ultimately, CBPR is a collaborative approach to research that equitably involves all partners in the process and recognizes the unique strengths that we all bring. So this is researchers, this is community, this is institutions. Ideally, CBPR begins with a research topic that is important to the community, not to the external researcher or entity that is engaging in this process, with the aim of combining knowledge and action, this concept of praxis that I know some of you have heard me talk about before, to achieve social change, to improve health and eliminate health disparities. And so It's not a specific method or set of methods because it can include qualitative research, doing interviews. It can include quantitative research, conducting surveys. It doesn't really matter which tools you bring. The central point of it is this image is showing here. The original model of research is the academy or the university or the researchers are the center and the community is off on the side. We do research upon the community. But CBPR flips this and puts the community at the center along with the technical expertise that the academy, the public health department, and others can bring to it. And it has an applied goal. It is not the generation of knowledge for knowledge's sake. It is the generation of knowledge to change systems, programs, policies, and ultimately to improve health equity. The last piece on here is this idea of knowledge democracy. And all this simply means is that we all know something, and we need to value the knowledge that our community members have. Even if they have not gone to the highest levels of education, their lived experience, their knowledge is as important, if not more important, than that which we can generate from the academies. And we have to recognize that, and we have to bring that to bear and combine it together so that we can ultimately take action together. So there's a number of guiding principles. I'm not going to dwell on these too long because I want to get to some of the tools that we can use. But again, it's very similar to asset-based community development. Community is the unit of identity. This is where we start. We build on strengths. So you can't do CBPR without first engaging in asset-based community development. It facilitates a collaborative, equitable process or partnership and fosters co-learning on both sides. You have to go in with an open mind and an open heart to be able to engage successfully in CBPR. It's as much about generating knowledge as it is about doing something with that knowledge. And it has to be on issues that are of local relevance to the community. If that's not achieved, then ultimately you will never be able to do it successfully. A key principle within CBPR is that whatever is learned, whatever data is collected, has to go back to the community, has to be analyzed in collaboration with community, because that context matters, because the action on which data will be taken has to be understood by the community that you're engaging with. And then finally, it's this idea of broadening this idea of validity within research. And by what that means is that what is valid in scientific research may not be valid in the community. And so we have to validate what we learn collaboratively with the community in which we're partnering. So this question of why should we use asset-based community development in CBPR approaches? So you can look at this glass, and so there's like, some will look at this as half empty, some will look at it as half full. And part of it is that when we think about starting from assets, we can look at the strengths and assets that we have within our community, or you can view the deficits and the needs. And so ultimately, where we begin our focus, assets or needs, determines the direction and the mentality of the community we're engaging with. So when we start on needs, we're beginning with dependencies. We're reinforcing negative stereotypes and belief. Oh, you need this because you are community X. And it can generate a sense of hopelessness. Whereas if we start with a focus on strengths and assets, then it begins with it begins to move us towards this idea of empowerment and a sense of ownership within our community of what we're doing and how we get there. This is an image that I actually use to teach our medical students about community assets and why we need them. So you can think about the goal of community development and health to go from the present situation to a future state. That future idealized state needs to be verbalized by the community itself. But the only way to get there is to first think about our present situation. And when we take that non-strengths approach, that deficit approach, then we're moving forward towards a future that may require, that we may in our minds say, well, that can only be solved by external agents, right? It's a need. I've already known that this is a need, and I can't address that because it's something that's somebody else's problem. It's something that I can't solve. But if we begin with strengths, then people can see themselves in the solution and the future that they're heading towards. And this is the value of asset-based community development and CBPR principles. So how do we actually identify strengths and assets? So we need a strong connector. CHWs are the most essential strong connectors within our communities, or promotores, but it can also include our lay health advisors, our community leaders, faith leaders, etc. But these are people who should be gift-centered, well-connected, and trusted. They have to believe that the community has an ability to change, or else you'll never be able to move forward with an asset-based approach. You need to use participatory assessment and data collection, because that will create a sense of ownership in the process as well as in the analysis of data. And then, as I've already mentioned, leaning back into our health literacy and health communication skills, the two skills that we highlight in this is always active listening, never trying to apply our own perspective on the community with which we're serving, and acknowledge everybody's perspective. The minute that we dismiss somebody and their ideas, you've already lost that individual, and you've now lost some key gifts and assets within the community. It's really hard to give this talk without saying asset over and over again, so I apologize for that. But I want to wrap us up here with just a couple of quick tools that I have found really helpful in engaging in this process of community assessment and strength identification. And the first is this activity called Head, Heart, and Hands. Very simple. You facilitate a discussion with people about hands. What are things that we can do? What are our skills? Is it cooking? Is it gardening? Is it building a house? These are skills that all exist within our communities, but we don't often get times to share it with each other. I know that my neighbor can work on cars because that's what I hear from him every single day. But if he had another set of skills, I wouldn't be able to see it and observe it. And so unless we create the space to converse about it, we won't know. Heart. What are we passionate about? What are the things that get us out of bed every day? Is it dogs? Is it pets? Is it the environment? Is it our children? But once we can identify those, then can we match it with our skills and then ultimately with our knowledge? That's our head. So what are the things that we know? And oftentimes knowledge and skills kind of come together. But that's okay, right? And ultimately we're trying to create this opportunity for people to share with each other so that they can have the aha moment of what exists within their community. So head, heart, and hands, very easy conversation to facilitate. You can use a flip chart paper, however you'd like to do it, but you should definitely document whatever the ideas and the themes that come from the community itself. Oops, all right, I've already said all of those things. The second skill, and this is one that I know is very familiar to many people on this call, is asset mapping. So these are some images from communities that I've worked with in Africa and Haiti, just to kind of show you how we put them onto cloth so that it was something that people could actually physically hold and see. But they would map their entire communities. Where are our houses? Where are our schools? Where are our grocery stores? In developing worlds, where are our toilets? Where are our water points? Here, we can look at where are our healthy corner stores? Where are our unhealthy corner stores, so that we can begin to address that. But ultimately, you're identifying your associations, your institutions, and your physical assets. It gives us a conceptual model of what our community looks like, so that we can then begin to take action around the areas that we would like to address and or improve. So when thinking about how can we use a strength-based approach to the pandemic, I've identified just a couple of challenges on the left and a couple of potential solutions on the right. So information overload, we started with that question today with you. And so one of the ways that we may be able to address this is to develop trusted source lists with our community and share it, right? So people feel overwhelmed. Oh, it's Facebook, it's Twitter, it's the news, it's everything. And then we can come to them and say, look, I use these 3 things, and this is where I go for this information. And I highly recommend that you go there so it can help reduce that stress. How can we address misinformation and disinformation? Well, we can help people learn about online literacy. So how do you identify the source of a document? Where is this information coming from? So it could be an easy session on navigating social media, asking the additional question about who's the source of this information and should I actually trust what they're saying? How could we address access to preventive and curative services? Well, you could design a rideshare program, right? It could be that somebody's got a car sitting in their backyard that they just need to do an oil change for. But until we do that, we're never going to know that that asset exists. And then finally, we know that financial insecurity has also been on the rise. And so it could be that we work together and identify all of the employers within our neighborhood, and we can find employment opportunities for each other. We could create a childcare opportunity, whatever it might be. But until you start the conversation, it's really hard to know what the assets are to address those potential solutions. And what I'm really hoping is that from this point forward in the rest of our Echo session is we can think about what are some of the strengths that exist within our communities, and how can we match those to the challenges of the pandemic that we've been facing, so that people don't feel overwhelmed, can see themselves in the solutions to public health problems around access to vaccines, access to information, and otherwise. I'm going to wrap us up with this quote from Lao Tzu. It's one of my favorite. It's this idea of leading from behind, where you go to people, you live with them, you learn from them, you love them, you start with what they know and build with what they have. You honor people, and if you fail to, they will fail to honor you. And then a good leader in public health, when their work is done, the job is finished, the people will come back and say, we've done this ourselves. This is at the core of asset-based community development and CBPR principles. And so we want to keep in mind, it's not necessarily about us, but it's about the communities that we're trying to serve. This is just a quick list of some of the resources that I used to pull together this presentation. And I think I'm going to go ahead and end it there, and hopefully we can transition into a robust discussion about your own work and experiences using approaches like this in the community. So thank you so much.